Assalamu alaikum, I am Mehak. Hope you're doing well. In this video, I will give you a brief introduction about pterygium. Before it started, we should know about pterygium. A pterygium is a benign or non-cancerous growth that develops on the conjunctiva of the eye. Conjunctiva is a clear thin tissue that covers the white part of the eye, known as sclera. Pterygium may develop in one or both eye. Lesion is characterized by a pinkish triangular shaped tissue growth of conjunctiva that extend toward the cornea. A cornea is a transparent window covering the front of the eye. It usually occurs at the nasal side of the eye. The color of the lesion varies from pink to red. It may be small or large enough to interfere with vision. A pterygium may also cause suffering. Causes of pterygium eye disease is not known, but it can occur more often in people who spend time outdoors with frequent or exercise exposure to sunlight or wind. People who spend considerable time in the sun, such as farmers, fishermen, or people living near the equator, are more likely to develop pterygium. Genetic predisposition is another factor may play a role. Symptoms of a pterygium is a painless area of elevated tissue with visible blood vessel on the inner or outer border of the cornea. The condition can cause extreme eye discomfort including burning, irritation, redness, tearing, foreign body sensation, astigmatism. If the growth becomes large enough, it may begin to inhibit vision. To diagnose pterygium, your eye doctor conduct a complete physical examination of eye and eyelids. No special tests are necessary. Treatment depends on the size and extent of the pterygium. Treatment is usually not required in mild cases. When pterygium becomes red and irritated, steroid eye drops may be prescribed to reduce the inflammation. If these eye drops are recommended, you should remain under the care of your eye doctor. In case in which the growth unsightly or vision is threatened, your eye doctor may recommend surgical removal of the tissue. The most common surgical technique used today involves the simple excision of the pterygium combined with conjunctival autografting. During the procedure, pterygium is removed. The removal of the pterygium is filled with a tissue transplant. Beta radiations also be used to minimize the recurrence of pterygium, although these therapies slow the regrowth of the pterygium. Complications such as ulceration, perforation in the wall of the eye. In severe cases where the growth extends toward the center of the cornea, a laser treatment may be needed. An excrement laser is used to smooth the irregularities and improve post-operative care. Following surgery, you may experience soreness and irritation in your eye for a few days, for which antibiotic steroids combination eye drops may be recommended. You can turn to your normal activities within 1 to 2 weeks after surgery. Make sure to use eye drops and protective measures as directed by your doctor. Other surgical complications include scarring and perforation of the cornea and astigmatism blood. Prevention measurements includes protecting the eye from ultraviolet rays by wearing the sunglasses with the UV protection during the outdoor activities. Also use artificial drops to lubricate the eye. Thank you so much. Hope you like the video. Allah Hafiz.